A child with separation anxiety might have extreme difficulty saying goodbye to her parents, being alone on one floor of the house, or going to sleep in a darkened room, because she is terrified that something will happen to her or her family if they are separated. She might avoid playdates and birthday parties. At home, she might shadow one parent constantly. Separation anxiety could also trigger stomachaches, headaches, and dizziness in anticipation of the separation. Obsessive-compulsive disorder (OCD). If a child is plagued with intense fears, and feels compelled to perform repetitive rituals to make them go away, she may have obsessive-compulsive disorder (OCD). Children with OCD are overwhelmed by unwanted thoughts and fears, obsessions, which they diffuse by repetitive actions, compulsions. For example, a girl might be afraid of burglars robbing the house, but someone with OCD believes burglars will come unless she touches everything in her room. Common obsessions are fear of contamination, fear that they or someone close to them will be harmed, and fear that they themselves will do something terrible. Children may compulsively wash their hands, lock and relock doors, or touch parts of their bodies symmetrically to neutralize the fear and make themselves comfortable. They may also repeatedly ask questions and seek reassurance, and they may insist that others participate in their rituals. Specific phobias. A phobia is an illogical, all-consuming fear about a particular object or situation: dogs, clowns, loud noises, water, insects, the dark, etc. This crippling fear will manifest when your child is confronted by the trigger directly or indirectly, such as seeing an image or hearing a song about it. Children with specific phobias will anticipate and avoid their trigger, which can severely limit their activities. They may cry or throw tantrums to avoid the object of their distress, or experience physical symptoms like trembling, dizziness, and sweating. Diagnosing anxiety in kids. Anxiety in toddlers and children often goes undiagnosed. Many parents think that their child will grow out of his issues or that it's normal for a child to be nervous, says Wendy Silverman, Ph.D., director of the Program for Anxiety Disorders at the Yale School of Medicine. However, anxiety disorders make children's lives harder and limit the experiences they can have. It's unlikely that a child will outgrow an anxiety disorder, says Reinaud Bedas, Ph.D., Associate Professor of Psychology at the Perelman School of Medicine at the University of Pennsylvania. When it's left untreated, she'll have a higher risk of substance abuse later. If you think anxiety is interfering with your child's ability to function, seek services early instead of waiting it out. Ask your pediatrician or school guidance counselor for a referral to an expert and schedule an evaluation. The clinician you see should have diagnostic expertise and should explain the sources of information she's going to use. We recommend a board-certified child and adolescent psychiatrist, or a licensed psychologist. Treat this meeting with the same matter-of-fact attitude as you would when taking your child to the doctor for a sore throat, says Dr. Kurtz. Explain the visit to your child using the same words he uses to tell you about his problems. We're going to talk to someone who can teach you how not to worry at bedtime, for example. It's also a good idea to keep track of worrisome behaviors and when they occur, which might help identify possible triggers. How to help your anxious kid. Fortunately, anxiety is one of the most treatable psychological disorders in kids. The most common treatment options are cognitive behavioral therapy and medication. Cognitive behavioral therapy. For many kids, especially those in the early stages of an anxiety disorder, cognitive behavioral therapy, CBT, can improve symptoms within a few weeks or months. While CBT won't eliminate anxiety completely, it teaches children to recognize what they're feeling and manage those reactions. A child who has an obsessive fear of germs, for example, may learn to notice when his heart beats faster at the sight of someone coughing and to take deep breaths to calm down. He'll also learn coping techniques, such as telling himself, "Millions of people touch things every day and don't get sick." Finally, he'll be exposed little by little to his fear, going with the therapist to a public bathroom and touching the sink and then the toilet handle. How often and how long your child receives CBT depends on the severity of his disorder. Anxiety medication. Drug therapy might be recommended when a child isn't making progress with talk therapy alone, or if the anxiety is severely impacting eating and sleeping. Medication makes many parents uncomfortable, but doctors urge them to look at the big picture. If a child's symptoms have overwhelmed her capacity to cope and her parents' ability to help her, then it's appropriate to consider every option available, says Anthony Charavastra, MD, Assistant Professor of Child and Adolescent Psychiatry at NYU Langone Health. In fact, certain medications can often be an essential part of a child's treatment, he adds. For children with severe anxiety, 2 types of medication have been found to be especially effective: SSRIs and benzodiazepines. Selective serotonin reuptake inhibitors (SSRIs). These antidepressants increase levels of serotonin, which is a naturally occurring chemical in the brain that regulates moods. Examples are Prozac and Zoloft. Benzodiazepines. These anti-anxiety drugs also work, but they're used less frequently because they're linked to hyperactivity in young kids. They can also become less effective over time, says Dr. Charavastra. Common side effects for all anxiety medications include mild headaches, nausea, irritability, or sedation. If symptoms don't subside within a few weeks, the prescription or dosage can be adjusted, Dr. Charavastra says. Talk to your doctor if you find that your child's behavior or personality seems drastically and negatively different after starting medication. Anxiety treatment at home. If your child seems anxious but it's not interfering with his everyday life, you might try helping at home first. Here are some tactics. Help your child confront his fears. All parents instinctively want to protect and comfort their kids. If your child screams hysterically whenever a dog walks by, for example, you might try to keep him far away from canines. However, doing that may make things easier in the short run, but it reinforces his fear, says Dr. Ginsberg. Instead, he needs to confront the fear and work on his skills to manage it. You can help your child take small steps, like watching dogs from a distance and then petting a puppy on a leash. With each victory, celebrate your child's bravery with a small reward, like 10 extra minutes on the Xbox. Find out what's causing the anxiety. Before reassuring your child in anxious situations, find out specifically what he's fretting about first, says Dr. Chansky. Consider a child who's anxious about starting school in a new city. You may be tempted to say, "Don't worry. No one is going to be mean to you at school," when in reality he was really worried about finding his way around. Now you've given him something new to worry about. To figure out his specific concern, ask, "What do you think is going to happen?" Then think of several things that the two of you can do ahead of time to help ease his fear. Establish a bedtime routine. At bedtime, develop a calming ritual. Rather than allowing TV or other screens, have your child read a calming book or do relaxation exercises. Teach him to self-soothe. Tell your child about self-soothing techniques he can practice whenever his stomach is in knots, like deep breathing, counting backwards, or visualizing what he wants to happen. I tell kids that the worry in their head is one channel on the radio station in their brain, but they can change it whenever they want, says Jeremy Schneider, a family therapist in New York City. If they're worrying about not making the baseball team, they can just change the station to their own voice and focus on last year's vacation, or they can think about the people who love them. Evaluate your own mental health. Consider how your own anxiety might be affecting your child. Screaming at the sight of a bug in your room, for example, will teach him to be afraid of bugs too. So if you've been waiting for a good reason to seek help for your own anxious behavior, this may be it.